critical thinking, if you're looking at it from an academic perspective, you could say something like it's the art of analyzing and evaluating information so that you can make a judgment, so that you can make a decision. And the whole process of doing that, analyzing and evaluating, it requires experience. It requires knowledge. It requires experience, and it requires you to sometimes screw up and get better. It's a constant process. And I use the word art because that is something that you continually have to practice and do and gain experience at. So critical thinking is, bottom line, it's thinking about thinking.
Well, hello, future CRNA. I have some exciting news to share with you today. We have just released the Nurse Anesthesia Educators Unplugged, which is going to be your gateway to success. I want you to discover the inside scoop. I want you to be able to navigate the complexities of CRNA admissions and thrive as a candidate and as a nurse anesthesia resident, which can seem like a really daunting task. But what if you had a trusted guide at your fingertips? Which is why we're excited to introduce the Nurse Anesthesia Educators Unplugged, which is CSPA's private podcast, your one-stop auditory guide to achieving your CRNA dreams. The key benefits and features of this private podcast will be hearing directly from the experts, listen to seasoned CRNA faculty members who know the admissions process inside and out, get invaluable insights not found in brochures or websites. You're going to hear from behind the scenes and discover the lesser known details of the selection process, traits that faculty look for in candidates, and the hidden pitfalls to avoid. Also, knowing that all schools are a little unique, and this is going to give you that invaluable insight that's going to allow you to see the differences between different CRNA programs and the faculty that run these programs. You're going to hear real stories, hear from successful students who have been in your shoes, learn about their challenges and strategies and what made them stand out. You're going to get strategic advice. So beyond grades, how can you learn to craft a compelling application, such as for your essay or your interview responses that really will resonate with the admissions teams? You're also going to get flexible learning. You can listen to this podcast on your commute, during your workouts, or even while cooking. So we want this learning to fit your schedule. You're going to hear a lot of Q&As on these podcasts. These questions and answers are found in our private CSPA community. So again, we pick questions that are commonly asked from CSPA students, and we bring them to the table during this faculty podcast. So it's a great way to hear commonly asked questions from a variety of faculty and different insights on that. We also want you to stay up to date. The admissions landscape is always changing, so we want to make sure that you're updated on the latest trends and requirements and strategies for success. And then last but not least, we want to help you build confidence. Knowing what to expect and how to prepare can dramatically increase your confidence, giving you the edge during the application interview process. So I hope this sounds exciting to you. I hope you're as pumped as I am to tune into these shows. And remember, if you're a CSPA student, you're going to have access to this private podcast. But don't worry, we want to make sure we're not excluding anyone from this podcast. And so on occasion, we're going to share sneak peeks with you, our regular CSPA listeners, because again, I want everyone to succeed. And whether you're a CSP member for 12 months or for a short period of time, if you are a member, you're going to have access to the entire library of private CSPA faculty podcasts. So again, this is a really valuable resource that we are excited to bring to you today. And I want to just leave you with the conclusion that whether or not you're contemplating CRNA career or you're already deep in the application process, this Nurse Anesthesia Educators Unplugged is your secret weapon to equip yourself with the knowledge, strategies, and confidence to stand out. So I hope you enjoyed the sneak peek. Let's go ahead and get into today's episode.
All right, everyone. Welcome back to another episode here for CRNA School Prep Academy for our podcast on our Nurse Anesthesia Educators Unplugged. And I'm excited today about our guest. We've got Dr. Jeremy Heiner with us. Jeremy and I go back a long ways. We'll get into that in just a little while. But Jeremy is with the Kaiser Permanente School of Anesthesia. Jeremy graduated there 19 years ago, 2004. He's been practicing as a CRNA since. He's been in academics since 2008 for 15 years, holds an official position within the program as the academic and clinical faculty member, and Director of Admissions, which obviously works out well for this podcast. So we're excited to have him. And so, Jeremy, just want to say, man, good talking to you again and welcome to our podcast.
Yeah, thank you, Dr. Wilson, for hosting me. We've been trying to get together for several weeks now. I'm glad we finally nailed down a date. So I'm excited to be here and talk about anesthesia school, critical thinking, all the things today.
You know, one thing that we've seen, and we've been talking offline a little bit, you and me, is how we are seeing the nurse and the nurse anesthetist from years ago transition into what they are today. That means that the practices have changed, the practice models have changed, the education has changed, expectations, all of that. So really, in your mind, what is critical thinking all about?
Well, it's a really big topic. And I like how you use the word expectation, because really our profession, nurse anesthesiology, nurse anesthesia, we're expected to do a lot. And just look back at COVID and all the CRNAs throughout all the nation. They were asked to go into areas that traditionally they don't work in. And they were basically a plug and play. We were basically the MacGyvers of the hospital, and we could be put in any scenario, in any situation, and manage it. And so the expectation for us to be able to fill a role is high, certainly in anesthesia, but also in other areas of the hospital.
So what would you really say is kind of your definition of critical thinking, right? Because that's what a lot of these individuals want to know. It varies from institution to institution, I think, which is unfortunate. But what as an educator, as an admissions counselor, right, or admissions leader, what are you looking at when you talk about that critical thinking in the definition of it?
All right. So critical thinking, if you're looking at it from an academic perspective, you could say something like it's the art of analyzing and evaluating information so that you can make a judgment, so that you can make a decision. And the whole process of doing that, analyzing and evaluating, it requires experience. It requires knowledge. It requires experience. And it requires you to sometimes screw up and get better. It's a constant process. And I use the word art because that is something that you continually have to practice and do and gain experience at. So critical thinking is, bottom line, it's thinking about thinking. It's really getting into, how do I make a decision? How do I apply the knowledge that I've gained in order to make a decision? And when we're looking at in the clinical area, if you're an ICU nurse, how do you take that knowledge that you gained in nursing school, when you were studying for the CCRN, the times that you've been in the ICU and the patients that you've taken care of? How do you take all of that so that when there's a problem in the patient that you're admitting right now, maybe they're really hypotensive, how do you take all that information that you've learned and then make a decision that will benefit the patient?
Hey, future CRNA, another daily dose of inspiration from a CRNA School Prep Academy student. Thank you, CRNA School Prep Academy. I have applied to Case Western 4 times and got rejected 3 times. Those rejections happened before I found CSPA. After my 3rd rejection, I found an amazing mentor, Haley, through NTN's mock interview service, who told me what I need to do over the next year. I'm someone who did not do well in nursing school at the beginning, with a 2.7 GPA in undergrad and a 2.74 in RN school. I didn't know there would ever be any hope for me, but I worked my butt off to get a 3.8 in my RN to BSN, and I got my CCRN at the same time. I took some advising from the program director, who recommended that I take advanced pathophysiology. I got an A in that course. I continued to precept, do charge nurse on my units, and participate in some sort of committee. When I decided to do travel nursing, I was concerned I'd be looked at different. My program director at this time said while they take travelers, they found that travel nurses tend to take easier assignments than the program usually likes their candidates to take. I happened to be a charge nurse and preceptor on my current travel assignment. The director emphasized that I needed to mention this, which I did, because it put me apart from the other travelers. I also took my CSC this application year, which helped me study a lot sooner than I did in the past. I thought despite my efforts to consistently improve and prepare for my final interview at my top choice, my interview went poorly. I chose the first day, the first time slot, and I was more confident in my preparedness thanks to CSPA. Despite me not feeling the best, I wasn't going to give up. While working Hurricane Ian in Florida, I got a decision letter. I was accepted. I'm still in disbelief that after 4 attempts and 3 rejections, I finally got in. I couldn't have done it without CSPA, Haley, and the amazing mock interview mentors who have helped prepare me along the way. Use this service, it will make a difference. Thank you to all the Academy for helping me achieve what I thought was impossible. Endless thank yous. Dear future CRNA, I love this share, and you know who you are, so congratulations. I'm so incredibly proud of you. And if you're listening to this story, I would love to be able to help you as well. Be sure to sign up for our free Future CRNA newsletter just by clicking the link below in the show notes or comments. Cheers to your future. Now back to the show.
So I love 2 things that you mentioned there, and 2 phrases, which I'm just going to go ahead and forewarn you, I'm stealing one of them to use, which is thinking about thinking, which is, I think, a very big key when we look at critical thinking, because we do see and we are noticing that there has been a trend in healthcare, for better or for worse, of moving more towards protocols for quote unquote patient safety versus thinking processes, right? And I know this frustrates a lot of people, but we've got to think about what we're thinking about and being able to, again, the second phrase I love that you talked about was analyzing. So it's not just necessarily being able to say, hey, I've seen this issue arise, or I'm seeing this trend, or I'm seeing something occur. It's about really, when you talk about critical thinking, it's analyzing what you see and what you hear.
Yeah, it is. And, you mentioned protocols and checklists, and I'm actually a big proponent of crisis checklists. They're very helpful because we're all human. We can't retain all the information. It's in there somewhere, right? But we can't automatically bring it up all the time. There are a lot of other factors that come into play, especially in a crisis situation, that are going to impair your thinking to some degree. And so that's where these crisis checklists are very valuable. The key with crisis checklists are how to use them and when to use them, because you can't use a malignant hyperthermia checklist if the patient doesn't have malignant hyperthermia. They may have a fever, they may have an elevated end-tidal CO2, but that isn't necessarily malignant hyperthermia. So you have to get to the diagnosis first, and you have to have that critical thought process in order to get there before you can effectively use these cognitive aids.
Really, I can remember my first interview for anesthesia school. I was waitlisted after my first year, and I came back with more knowledge the second year because my director at the time told me to go get more knowledge in what I was doing. And I literally would fight for patients to get that practice because I knew that's what I needed. And without that repetition and that practice and an intentional focus on it, like you've already mentioned, I wasn't going to get better at it.
So, and there it is right there. You listened, right? Somebody told you what to do. You listened, and then you put yourself out there and you got the experience. You looked for those difficult patients. You sought out those challenging cases. And I think one other major key here is to always be curious. Like, always look to see what you can do better. Never be satisfied. Looking for those difficult patients, taking care of them, seeing what you can do better, looking after the shift, driving home thinking, all right, so I had this patient, they have these medications going. How could I have improved that? Or how could I have improved the hypotension that was occurring? Was there something that I could have communicated better, or a drip that I could have managed better, or even a medication that I could have suggested to the ICU attending that would have been a better option because I looked in and I researched Levofed better than dopamine in certain circumstances, right? So,
always. It always is.
Exactly. So yeah, and earlier I talked a little bit about practicing deliberately, and there's a concept called deliberate practice. I know you've heard of this concept before, and I'm sure probably some of your listeners have heard of this concept. So just to kind of break it down, if we're talking about deliberate practice, it has 4 components. It's essentially, you got to be motivated to do something. You have to have a goal. You have to be focused on doing it. You need feedback and you need repetition. So the focus is, well, the motivation is you got to have a goal in mind, right? So something you want to do, something you want to improve, and something that brings you out of your comfort zone, because that's really where the learning occurs, when you're not comfortable. And then the focus is breaking that down into small, manageable tasks. So some people will call these micro skills. If you're focusing on improving a procedure, we can break that down into micro skills. And I'll give you an example in just a second. And then once you are performing these skills and breaking them down, you need somebody to give you feedback, somebody who is an expert or a mentor or a coach or just somebody who's really experienced. You need some type of feedback. And then the thing that puts it all together is you constantly repeat it. That's how you do deliberate practice. Repetition, constantly doing it over and over and over and trying to improve. So let me give you the example. And this could be pertinent to some of your listeners in the ICU. Over the last decade or so, ultrasound has made an appearance in all clinical settings, really, and which is a good thing. And we use it a lot in anesthesia practice. And I think one area that ICU nurses may be able to use it is when they're placing IVs, intravenous lines. Mm-hmm. So I know they use it a lot in the ERs and in the ICUs. And we use it in anesthesia too. We get difficult sticks all the time. And this is a skill that will really benefit you as an anesthesia provider if you can put in an IV using an ultrasound. So if we're going to use deliberate practice with an ultrasound, you should be breaking it out almost every IV you do. Use it on the easy IVs and break the skill down. Get out of your comfort zone, right? Then break the skill down into micro steps. How do you hold the needle? How do you hold the probe? What is the distance between the needle and the probe? What exactly are you looking for? That little star of the needle as you're advancing it. What are you looking for in terms of the anatomy? And when you're next to the vein, what kind of things do you want to do to make sure you're midline and to see where you're at? And what's the feel? What's the length? So I would even practice on veins that you can see right at the skin, and that will help you kind of dial in those skills. And then have somebody who's really good at that watch you do it and give you feedback, and then repeat the process.
All right. Well, that sums up today's show. Thank you so much for tuning in. I hope you guys found that so valuable. And I look forward to, again, sharing some more golden nuggets with you guys in the future. Again, if you're a CSPA member, there will be an entire section inside the Academy that's labeled Nurse Anesthesia Educators Unplugged podcast. It will be inside the membership. So again, you log into your membership to have access to this. Again, you can play this on audio whenever you are driving or cooking or folding laundry, whatever fits your learning style. Again, we hope you guys find a lot of value in these episodes, and we're excited for future episodes to share with you. And until next time, thank you so much for tuning in. I appreciate you. Please be sure to share that if CSPA podcast has been helpful for you in your CRNA journey, I would so very much appreciate it if you were able to share this valuable podcast with others that you know who are embarking on their CRNA journey. I call it paying it forward. So again, if this has been a valuable resource for you, a valuable tool on your own CRNA journey, I would so greatly appreciate it if you were able to share it with someone else down the road, even if you don't know anyone right now. Keep us in mind to make sure you send people our way, because again, we want to help you find success. We want to help your peers find success. So cheers to your future, and thank you so much. And until next time, take care. Hey, future CRNA, as always, I appreciate you and your loyalty. Thank you so very much for tuning in this week. I'd love to hear from you, so screenshot this episode and share it to your IG stories with your biggest takeaway. Don't forget to tag me at CRNA School Prep Academy so I can personally thank you. Be sure to head over to CRNASchoolPrepAcademy.com to check out our blog and gather free resources to help you along your CRNA journey. Stay strong, and I'll see you next week.